Hi, I'm Vinod Thourani. I'm one of the cardiothoracic surgeons at Emory University and the professor of surgery and medicine in Atlanta. So what I'm going to talk to you about today is two trials here at ACC 2016 which have a major impact in the management of severe aortic stenosis. The first was presented by one of my colleagues, Dr. Craig Smith from Columbia University, who talked about the randomized trial, and Partner 2A is the name of the trial. What we were able to do is take surgical patients and also transcatheter valve patients and randomize them one-to-one. What's unique about this trial is that we already know that transcatheter valve therapies are used in extreme risk patients, they're used in high risk patients. Well, now we've come to intermediate risk patients. Those are patients who are in what we call a Society of Thoracic Surgeons, or STS, predictive risk score 4 to 8, roughly. What that means is that we're still talking about octogenarians. Our average age was just above 80 years of age, but they're not so high risk that we would, as surgeons, we would consider them non-operative. So basically what in the Partner 2A trial, what we did is we randomized the two, and we found that they were no different when you looked at all of the patients between transcatheter valve and surgical valve replacements. What we did see is that the 80% of patients who had a transfemoral, that's the transfemoral access route for TAVR, they did seem to have a much improved survivability at a p-value of 0.05 compared to surgery. So what we're saying for the overall implications for the Partner 2A trial is that in those patients who had transfemoral transcatheter valve therapies, they have a superior results compared to surgical valve therapy in intermediate risk patients. So there have been device iterations. In fact, the SAPIEN-XT valve is no longer sold in the United States except for valve-in-valve cases. So what industry has done is they have moved from the SAPIEN-XT valve to the third generation valve known as the SAPIEN-3 valve. The SAPIEN-3 valve has some device iterations which are very important. Number one, it addressed the idea of leakage or the paravalvular leakage after the valve is implanted. And in those patients, SAPIEN-3 has this special cuff on the ventricular part of this which should minimize that. Number two, it went from an 18 and 19 French sheath for transfemoral access to a 14 French. And therefore, in the SAPIEN-3 trial that I'm going to describe to you, 90% of patients, close to 90% of patients had transfemoral access. The third component is that there are 4 valve sizes to really fit even the smallest woman to the largest burly man. So it really covers the whole gamut of valve sizes that are needed. So what we did in coordination with the FDA, we didn't perform a randomized trial. We used the surgery patients, the same intermediate risk surgery patients from the Partner 2A trial. We used those surgery patients and we did a propensity score analysis with 1,000 SAPIEN-3I patients. That's SAPIEN-3I meaning SAPIEN-3 intermediate risk patient population. And what we found after we did a non-inferiority analysis and then a superiority analysis. What we found first was that the TAVR, SAPIEN-3, was non-inferior to surgical valve therapies. We used a composite endpoint, a composite primary endpoint, which was mortality or stroke, all stroke, not just disabling, but all stroke, and also greater than or equal to moderate aortic regurgitation. So we were non-inferior, and so therefore, since we were so non-inferior, we did a superiority analysis. And in this primary endpoint of all mortality, all stroke, and greater than or equal to moderate aortic insufficiency, we found that transcatheter valve therapy with the SAPIEN-3 was superior to surgical therapy in the intermediate risk population. Even when we broke it down into individual components, we still see that TAVR with the SAPIEN-3 is superior to surgical therapy. We did find that surgery was superior to TAVR in the rate of paravalvular leak. However, the rate of paravalvular leak, and this is the best leak rate ever reported at 1 year, is 1.5% with the SAPIEN-3. So we're talking about remarkable results. We're talking about a mortality in intermediate risk patients of TAVR at 7.4%. And we're talking a paravalvular leak of 1.5%. Both really incredible results, and quite honestly, set a new bar for all transcatheter valve therapies that are coming forth. So to summarize what we've seen at ACC 2016, we have seen 3,000 patients either in a randomized or extremely rigorous FDA-approved propensity score analysis. And in those 3,000 patients, we're seeing that transfemoral transcatheter valve therapy is superior to surgical valve therapies in this medium risk population. So we're cutting edge, really, or cutting into a new paradigm shift that it'll be interesting to see when FDA approves this valve for you and I to use all over the world.